Let me ask you something personal. What if the most powerful medicine for your diabetes wasn't a pill? What if it was something humble, something crunchy? Something that costs less than $1 a day? Today, I'll tell you about a small handful of magic most people ignore. Peanuts. They're not just a snack. They're medicine, the quiet kind that works behind the scenes day after day, meal after meal. Peanut basics. Not a nut? Doesn't matter. Yes, I know. Peanuts aren't technically nuts. They're legumes. But what matters isn't what we call them, it's what they do inside the body. 1 cup of raw peanuts contains 24 grams of protein, 72 grams of healthy fats, and only 15 grams of net carbs per cup. That makes them a powerful, blood sugar-friendly option. With a glycemic index of just 13 and a glycemic load of 1 per ounce, they barely nudge your blood sugar at all. Why peanuts stabilize blood sugar? When added to a high-carb meal, peanuts reduce the glucose spike. The trio of fat, fiber, and protein slows digestion and absorption. This creates a steady, calm glucose response instead of a dangerous spike. Eating peanuts daily improves insulin sensitivity and supports better metabolic balance. Nutrients that work in silence. Peanuts are loaded with niacin vitamin B3, which supports nerve health. They're rich in magnesium, crucial for insulin function and blood sugar regulation. Antioxidants like resveratrol and flavonoids reduce inflammation and protect blood vessels and organs affected by diabetes. Circulation, healing, and arginine. Peanuts contain arginine, an amino acid that boosts nitric oxide production. This relaxes blood vessels and improves circulation. For diabetics, that means better wound healing and less risk of complications in the feet and legs. Pro tip: bedtime snack. Try 1 ounce of unsalted or dry roasted peanuts before bed. This bedtime snack slows overnight glucose release, helping lower morning blood sugar levels. It keeps you full, improves blood flow, and supports insulin function during sleep. Heart health and cholesterol. Peanuts are rich in oleic acid, a heart-healthy fat also found in olive oil. Regular intake lowers bad cholesterol LDL and increases good cholesterol HDL. For diabetics, this is critical in reducing the risk of cardiovascular disease. Weight control without starvation. Though high in calories, peanuts are filling and reduce the urge to snack. They support weight control, which is closely tied to better blood sugar management. Including peanuts helps reduce overall calorie intake and belly fat. Section 8. Recommended intake: 1 to 1.5 ounces per day. Best forms: raw, unsalted, or dry roasted. They pair well with apples, inside wraps, in smoothies, or as natural peanut butter with no added sugar or hydrogenated oils. Precautions: peanuts are generally safe, but avoid flavored versions with added sugars. Those on blood thinners or with allergies should consult their doctor. Myth busted: peanuts aren't fattening when consumed smartly. The fats they contain are beneficial anti-inflammatory and heart protective. They stabilize blood sugar, reduce cravings, and fuel your metabolism. Ending note: next time you pass a jar of peanuts, don't ignore it. It might just be the quiet guardian of your diabetic health. Stay tuned. Next up, we'll dive into walnuts, the brain-shaped nut that's more powerful than you think.